Hi everyone, it's Dr. Carl here. It's been a week now since we left Albert Park and we've had Formula One and Supercars events postponed till later in the year. So I want to have a chat with you about the current corona situation. So whenever we turn to social media, the news, websites, we see doom and gloom. It's really easy and natural to feel scared, wondering what's going to happen to us all. But look, there are things that you can control and some things you can't control. I read all the media and such, and then I try and put that in a box to say, well, I can't control that. I can't affect any of that as such, especially the negative media side of things. So I just put them in a box and focus on the things that I can control. The things that I can control are firstly about personal health and family health. So there's both physical and mental. It's really important not to diminish the importance of mental health. We're all anxious, we're all fearful. Those things we can try and minimize, looking after each other's anxieties. We need to ask questions and get the right information. Physical health, we've all heard the term social distancing, which to me means to quite simply keep 1.5 meters away from people. The social word is really important, which means don't lock yourself away. It's not time for that yet. We may eventuate to that, but it's certainly at this moment, that's not the key. What we should be doing is still socially interacting with people. Just keep that physical barrier though. We know that this virus is a droplet living virus. So, when someone coughs or sneezes, you need to be well away from that. If you are sick, clearly the advice has been you should not go out. Stay home, isolate yourself, quarantine yourself, look after your own health, eat well, sleep well. Time and time again we hear about hand washing, the importance of hand washing. Because someone might have touched this surface or so, if you then touched a shared surface, then you need to wash your hands diligently. If you can get access to alcohol washing, then that's easy. But otherwise, just any tap with running water, at least 20 seconds, with soap, that's the way to keep your hands clean. And then it's really important not to put your hands to your face. It's really hard, and I'm trying not to myself, just to scratch the nose or scratch your eyes. Really be mindful of where and how you use your hands. When I go out, when I'm at work, whether standing or sitting, I try and keep at least 1 meter, if not 1.5 meters from people. I don't wear a mask unless, this is in an emergency department, I don't wear a mask unless the patient that we're dealing with is a suspected coronavirus patient. So as we've all read, there's no value in wearing a face mask out in public, especially if you're well away from people. There may be some special circumstances for that, but in general, you don't need to be wearing a face mask. Let's use technology to our favour. Use FaceTime, call your family, your parents regularly. There's a new Netflix app where you can watch movies together and comment about them. With our mental health, it's important to try and isolate all the negative pictures that we're seeing. It's important to get into behaviours such as stop reading the news after a particular time, don't go onto your iDevice to check your social media. Before you go to bed, it's important to try and lock that away, focus on more important things like family, and not dwell on the negative, so that you can then get a good night's sleep, which is critically important. I'd like to share with you some of the videos that are available online that illustrate this, so I'll just cut to those. So the first video shows what happens when a virus is uncontained, people aren't looking after themselves and others, and the virus just spreads. The second video shows when a country tries to quarantine and puts up a wall, but if there's a gap in that wall, which ultimately there always is with travel, international travel, ease of travel, and if the virus gets through and the country's not doing what it's supposed to be doing, again the virus just spreads like wildfire. This third video shows what if 75% of us practice social distancing and social responsibility. If and when we get sick, we quarantine ourselves, we don't move around, we minimize exposure to others, and we can clearly see the slowing down of the spread of the virus in the community. And this final video shows when 87.5% of us do the right thing and not move around when we get sick, quarantine ourselves, and look at the noticeable difference here. Look how slowly we can make this virus reducing the spread. You can imagine the impact that has on all the health services. If there aren't 1,000 people attending in one day, instead it's just 10 people, that's really manageable and we can contain it and we can beat this virus. A common question is, what do I do every day? I live in Melbourne with my family. I have 3 kids. 5 days a week I go to work. I work in 2 emergency departments in Melbourne. In the mornings we get our 2 boys who are older and go to primary school. They still go to school. I do believe that it's still safe for children to go to school as long as the proper precautions are being taken. Okay, we've all seen pictures, or we might have seen it ourselves, the empty shelves in the supermarkets. You know, this is really bad, and we all know it's really bad, but it's human nature. It's not fair to call these people idiots. You know, it is human nature to react like this. There's a concept called the zero risk bias, which we're all prone to, and it's an attempt for us to try and regain some control. If it is that we can control and say that, you know, we can get enough dunny paper, then that's why people are doing it. Some people also rationalise that they're buying it for other people to look after them. But at the end of the day, you know, this is part of social responsibility. We need to really try and look after each other and not just think about our own needs. So what are the key takeaways? The first and most important thing is social distancing. As I've explained, just keep that extra space between yourself and other people. Do still see people, however, just be considerate and mindful of those that you're visiting. You know. The second takeaway message is personal health, and that includes both mental as well as physical health. Mentally, you know, it's hard for me just to tell you not to be anxious. We're all anxious about things, but just try and minimize your taking in all the negative side of this. Look for the right information, and at the end of the day, just try and put that away in a box and say, you know, I can't control that, but I can control this. I can turn off that media and not look at that today and deal with what I've got in front of me and look after those in front of me. My third takeaway message to you is about social responsibility. So that really is about looking after yourself and about others. If you're sick, please keep yourself away from other people. If you're well, you know, think about other people. Think about the elderly, the infirm. Well, what can I do to help everyone else? You know, these are things that we can focus on, and I challenge you to do that.